Quality Esports 24, where sports thrive.
This is Sports 3 on the network service of NTA, Africa's largest television network. Warm welcome to our conversation segment on this show today. And we're going to talk about health-related issues as regards sports. And I have with me to dissect the issues surrounding health and sports in the house. His name is Dr. Ezeigwe Tobechkwu. Doctor, you are welcome to the program.
Thank you very much.
All right, let's quickly go straight to the business of the day. Health and sports. Do you have any correlation?
Oh yes, health and sports are they go hand in hand. So you see, someone has to be healthy to engage in sporting activities. So to be more specific, I would say if you are not physically fit enough, you shouldn't engage in sporting activities, especially the strenuous ones, because the body needs energy to perform these activities. So there are some kind of tests you might need to do before you can say, oh, at least you are fit to undergo the basic sporting activities that are taking place.
Okay, I was opportune to witness a program by the Join the Cast initiative. Could see players having to do some tests before playing. So what does it mean? What kind of tests are they doing? What does that mean? For a layman, probably on Sunday evening, I want to go out and play football. Why do I need to check my health status?
Oh yeah, you need to check your health status because, for example, let's say the person that wants to play football has not had any breakfast or lunch throughout the day. He has not had anything to eat. So he is working on an empty stomach. And the body carries out these activities through the help of glucose. Glucose gives energy. So when the person is on an empty stomach and you try to carry out these activities, the body is working on its reserve, of which if it eventually gets depleted, the body has nothing to work with. So it can lead to fainting. Wow. In fact, the commonest cause of fainting during basic minor exercises like walking, jogging, is due to low level of glucose in the body. We call it hypoglycemia.
Okay, it's also the family of sugar, right? That
Let's just call it sugar. Let's call it sugar.
All right, at least for our viewers to actually understand us. But another thing that one school of thought is that probably it also has to do with the blood pressure.
Yes, so in practice in medicine, there's something we call vital signs. So when you say something is vital, vital means life. So when these signs appear to be normal, you can believe or say, oh, this person is healthy, at least healthy enough for the time being. So one of the things you check in vital signs, apart from the sugar, is the blood pressure.
Okay.
I mean, you also need to know the heart rate, but we are talking of the blood pressure right now.
Okay.
So the body functions through the blood flowing through the body. So if the blood pressure is too high, or too low, such person should not engage in such activities. In fact, someone that has a very high blood pressure and the person is hypertensive and the blood pressure is very high already, maybe tending towards an emergency, a hypertensive emergency, you shouldn't engage in any sporting activity for the time being, because increase in heart rate can lead to increase in the blood pressure when you start to exercise, and before you know, the person might just
okay, does it mean that can this be associated or associated with we have cases of players, not even football players now, we have even wrestlers, we have boxers have just suddenly collapsed on the boxing ring and they will die?
Okay, well, there are so many factors that can play a role in that. I mean, I cannot say for sure except I examine such a person.
Okay.
But in my own opinion, I don't think it will be due to the blood pressure. I'd rather believe it's a head injury from the heavy punches they receive on the head.
Wow.
Yes.
But we even have case of footballer like the great legendary Sam Okoraji that fell on while playing on the football pitch and he died. Some people are associated with probably heart rate or the high blood pressure.
Well, nobody can say for sure what made him collapse, but I'm sure there were some systemic conditions like
that could have contributed
to it and possibly aggravated it.
Okay, so what is medical advice on the fact that some people still use injury? They know they have injury. Like, what is the medical line of thought?
Okay,
an injured player going for a major tournament.
Well, I'm going to use an example. This example just came to my head. I don't care. I'm going to use it by the way. So just imagine if you have a car that it's bad, probably the engine is not functioning so well. The engine is like the heart of the car. And you use that car to drive from, let's say, from one location to another that is close. Let me use maybe something like Oshodi to Sele. Of course, the car could take you. But if you decide to use that car and travel from Lagos to possibly Abuja,
Okay.
the car is going to break down and collapse. Wow. Why? Because the car has been given more work to do, something it cannot carry out because it's not fit enough. So it's the same thing with the human body. If you have an injury, the body is not fit enough to perform those activities the way it's meant to. So when you carry that injury and stress the body out, one of the ways the body tries to relieve stress is to rest. And that is why I always say people faint. And when they faint, by the time people run around and pour out on their body, they wake up. Most times they wake up because the body has gotten that little rest it needed to get back.
To get back to life.
Exactly.
Wow. Okay, let's talk about some people wearing masks on the football pitch, doing some other sports. Some people even wear, how do I call it now, to protect their head. Is this the best way to go?
Well, for me, I would say yes, because I used to play football a lot, but I will not forget the day I jumped to head a ball, and someone used his head to headbutt my teeth, and my teeth cracked.
Wow.
When I went home, I was still in secondary school. I couldn't tell my parents that it was ball I was playing. So, I mean, since that day, I still play football, but I don't use my head to do anything again on the pitch. Let me be sure it's safe. So I believe wearing those protective masks can cover or protect the face. The face is like a vital place that doesn't need to be damaged for any reason. And imagine if someone uses the hand or the leg to kick someone on the face or on the teeth, and you knock out one of the tooth, it could be something permanent. So I believe these footballers are just trying to protect their face. So
okay, like the case of Victor Osimhen, he has been carrying this mask for a while now. Do you think is he healthy for him?
Well, yes, it is, but I don't know the rationale beyond how long he's supposed to wear it, but I know he had an initial facial injury. I don't know which to be specific, probably a facial fracture.
It's the jaw.
Exactly.
I think either the right jaw or the left jaw.
So if he had a jaw fracture, the jaw needs to be supported. There are muscles that support the jaw, but the jaw needs to be supported by that
mask.
Yes, that he's wearing. So I believe he has not completed the healing phase. So if he takes it out and someone hits him there again, it's like starting all over again. So.
All right, so let's talk about the fact that in a team, probably either during training, after training, or even during a match play,
okay,
some player breaks down on the pitch. Some would prefer to be stretched out on a stretcher. Some will walk out of the field, and they'll still go back after putting some pain reliever. What can you say about this?
Okay, so some patients can have what we call muscle spasms on the pitch, and they might not be able to move their legs or their hands normally, and so these kind of players will prefer a stretcher, because at that point in time, the muscle is what helps you carry out the action. Muscles have actions to carry out. So for example, let's say you want to walk out of the pitch, you can't walk, so you need a stretcher to take you out, and so many things can cause spasm in the muscles. So the health professionals around there, I believe they have what to use for adequate treatment. They spray.
Yes, they have the sprays, but my own concern is that they couldn't ascertain or do any test as at that time that the thing happened, probably an elbow or a blow or whatever, and they will still allow such athletes to go back to the field of play when you have not even ascertained the level of damage or of injury that has actually happened to them. That's my concern.
Okay, so there are cases where you would need to know what exactly is wrong with the player before letting the player back in. If a player suddenly starts gasping for air and collapses and goes out, they won't let the player back in, most likely, because it's a systemic problem. It could be the heart, it could be anything, and that footballer will need to carry out some tests to be fit back to go back to the pitch. But if it's a case of a minor injury, either on the hand or on the legs, that is it's not something that's going to kill somebody. So if the person goes out and the health people examine and sees that, oh, okay, this is just something minor, he can get back on his feet and play. Of course, you let your star player back in now.
Okay, in the case of spits now, some players spit on the football pitch. How healthy is this? Is it advisable?
Well, the human saliva contains a lot of bacteria. I mean, one of the things every footballer should avoid is a bite from a fellow human.
Bites?
Yes, the bite of a human being is actually dangerous enough to be deadly. Yes, some people say the bite of human is more dangerous than a dog bite.
Wow.
Even though the human is not rabid, but the concentration and amount of bacteria the human carries in the mouth, you know, you can bite it directly into the bloodstream,
person's bloodstream.
depending on how deep the bite is, and the wound can get contaminated, and the patient can come down with wound infection and all what's not.
So what is now your advice for players, athletes about the care of their teeth, their mouths, at least to reduce the level of transmitting probably bacteria?
Okay, so then getting into the dental field, I would say it's advisable for every football club or country to encourage their players to have a routine dental checkup, at least every 3 to 6 months, for possible scaling and polishing, you know, to clean their teeth, because, you know, when you have the heavy build of plaque and calculus in your mouth, the bacterial load increases. But after the scaling and polishing, the bacterial load reduces, and, you know, at least you can reduce your chances of infecting anybody, even if you're violent enough to bite.
Okay, before I allow you to go, what would be your general advice for players, athletes, boxers, handballers, volleyballers?
I would say generally footballers or anybody that engages in any sporting activity should avoid excessive consumption of energy drinks. I'm not saying they're bad, but I'm saying excessive consumption is actually bad, especially for the kidneys and for the teeth.
Energy drinks.
Yeah, energy drinks. We don't.
Should be avoided.
Yeah.
All right, that quickly reminds me, because of our time now, the issue of dope tests, finding banned substances in players' urine or sample.
Okay.
How can we curb this, and how the player gets into this? Some players will claim that they don't know about it.
Well, the truth is, I can't really say for sure about that part, because I think it's a relative choice in players. Not every player engages in such activities, while some do. You know, it's like asking, oh, what do you think about the issue of smoking? You see, no matter how you talk from now to tomorrow, some people
But is it good? Is it advisable to take some of these substances that enhance performance?
No, it's not. It's not. I mean, people don't take them and they perform adequately, so I don't believe anybody should consume such substance.
All right, Doctor, thanks for coming on Sports Street. We really appreciate you. And that is the word of Dr. Ezeigwe on Sports Street today. Avoid banned substances. Make sure that your health record are intact, 100% good health record. That is the way to go for you to play safe and be a successful athlete or a sportsman or woman. Sports Street will return after this time out.